The mission of the Health Policy Institute of Ohio is to provide the independent and nonpartisan analysis needed to create evidence-informed state health policy. We look at metrics related to both overall health of the population of the state of Ohio and healthcare spending. Our analysis of those metrics found that Ohio ranks 46th on health value, which means that many other states are performing better than us in both health outcomes and in healthcare spending. Researchers have estimated that our health is influenced by a number of modifiable contributors. About 20% of our health is influenced by clinical care, meaning access to care and quality of care. About 40% of our health is influenced by our social and economic environment, 10% by our physical environment, and 30% by our health behaviors and choices. So while we have focused a lot on improving access to clinical care, and that's critically important if you're sick or if you have an accident or injury, we really need to be focusing on all of those other categories and making sure that people have jobs with good incomes, decent education so that they can get those kinds of jobs. People are making good healthy decisions and have, live in places that are conducive to making those healthy decisions. Well, I think one, by understanding all of the factors that influence health and knowing that just providing access to health insurance alone isn't going to be enough to move the needle on health outcomes. Other things like the environment in which people are working make a difference. For example, offering, where possible, flexibility in scheduling so that people can manage stress and take care of their family concerns. That is something that is conducive to health. Also, just having paid time off in order to take care of your own health or the health of your family also makes a difference to health. The kinds of food, if you're a large employer and you have a cafeteria or food service, the kinds of food that you're serving, and whether the workplace is conducive to movement and getting a little bit of fresh air during the day. All of these things influence people's health and need to also get attention in addition to health insurance benefits. So the Ohio Department of Medicaid has submitted a waiver request to the federal government to institute work requirements for certain people who are on Medicaid. Those who would not be held to those work requirements are people who have chronic health conditions, people who may be getting treatment for addiction or mental health issues. But for others, there would be work requirements put in place. That waiver request is pending with the federal government. So we're waiting to hear back whether or not that will be allowed here in our state.